Hello, I'm so excited to tell you that we've received the approval from the feds to be able to give boosters to anyone over 18 years of age. And this is really so important, especially as we enter into Thanksgiving week. We've given over 125,000 doses, and I'm so thrilled that we've given over 2,000 doses to kids between that 5 to 11 age, as well as over 10,000 booster shots. And again, here are the hours where our site is available. Obviously, we're going to do a shortened week for Thanksgiving, but do appreciate your patience and look forward to seeing you after Thanksgiving holiday. Today, I want to tell you about the generosity of Lynn Giglio, who's willing to share her family's story with us. Lynn works as a clinical trial manager in our oncology department, and she was so excited last December when she was able to get the vaccine. We were obviously one of the first to be able to offer it at the end of December. And our dad is a World War II vet, and she immediately made sure that when he was eligible, he was scheduled. But there were a few weeks in between the time that he actually was able to get in. And unfortunately, he contracted COVID pneumonia, which took his life. In retrospect, she says that, she's getting this booster today for her dad. So Lynn, I thank you for sharing your dad's story and your family's story. Obviously, we are so sorry at your loss, but appreciate your willingness to make sure that you remind people that even though it feels like we've been in this forever, there are real costs to not getting vaccinated. And including in that vaccination are also flu vaccines. Last year we didn't even get to a moderate level of flu spread because everybody was really hunkered down. So please take the time to get your flu vaccine, whether it be from us at Inspira, retail pharmacies, or any of the retail pharmacies or your physicians in the area. It really is just so critical that we try and go into this holiday season as safe as possible. So under federal law, every 3 years, every hospital in the country is required to do a community health needs assessment. This needs assessment serves as the platform for the identification of things in our strategic plan where we must focus our attention. And it really is about two sets of feedback. One is the data that we look at that just tells us what the general health needs are of our community, but the other is from you, our stakeholders, to be able to express your opinions on the things that you think are of greatest concern to you. So you will be hearing more about this in the coming weeks. Please look for the feedback that we'll be asking you for in a survey. And this survey should only take about 15 minutes. I promise we'll get it in and out. But then we will actually report out on that information and use that to develop our community health needs assessment plan, which then must be incorporated into all of our strategic initiatives and placed on our website. Your feedback influences this process and makes us a better organization. So thank you very much for that in advance. This week also represents National GERD Week. GERD is commonly known as reflux, but we know it as gastroesophageal reflux disease. It can present as a heart attack when it's really fully blown, and it just is so frightening. That's why it's so important that you take advantage of the gastroenterologists that are available. At Inspira, we have a team of them that have joined us over the last couple of years, and we're so excited that they're bringing their expertise to our area. And again, they can walk this journey with you. It's really important that you know what your triggers are, that you understand how to manage the disease, and again, that you get the help of a physician. Again, I really do want to take this moment to wish you a happy Thanksgiving. There is indeed so much to be grateful for and so much to be thankful for. And so I do want you to know how much Inspira appreciates the support that you provide to us, the input that you give us, and most importantly, that you trust us to walk this healthcare journey with you. Until we meet again, be well and stay safe.